And then they made for I'm Jason Pataki. I'm a spine surgeon here with Stevens Point Orthopedics. This is Mr. Bones. He's our assistant here today. Will spinal surgery help with pain and stiffness in the neck or in the back? Probably not. The reason why is there aren't a lot of surgeries which actually increase motion. We do have some surgeries which can try to preserve motion, but that doesn't mean it's going to make it better. For example, replace a disc with an artificial disc that still moves, but that's probably not going to give more motion than somebody had before. And in fact, a lot of the surgeries we do actually fuse the bones together. So it takes the vertebrae of the neck or the lower back and it puts them together as a solid chunk. And if anything, you're going to move less and you're going to have less mobility afterwards. And so a lot of people do have problems with stiffness, and unfortunately a lot of times with that, surgery is just not going to eliminate or improve that. Do I have to have lower back or neck surgery? Most of the time, no. Generally, I tell people to look at it like you're getting a knee replacement. You would never say, oh my gosh, you know, I've taken anti-inflammatory medicines and I had my knee injected and I'm still having knee pain, and if I don't have a knee replacement, it's like a heart attack or a brain tumor and it's a big, I've got to have it done. No, you would make that decision based on how much it bugs you, how it interferes with your quality of life, where you are in your life. Can you go through with something like that right now? And is it worth the risk to you? And the vast majority of back and neck issues are in that same category, believe it or not. Okay. Do you do spinal injections or nerve burning? So basically, no, not really. You know, it's a little bit different from general orthopedics. If you've got pain in your knee or pain in your shoulder and you go see an orthopedic surgeon, you can expect pretty reasonably that they can do those injections in their office, and they kind of, if you ended up needing surgery, they do that too. With the spinal injections is a little bit different. You know, you've got to put the needle in a very specific place. You need to use sometimes a CAT scanner or a fluoroscope machine. Those things often are done by either interventional radiologists or pain management specialists or physiatrists. Now, sometimes, sure, we can see a patient and let's say a specific nerve is pinched in their back and they're having bad leg pain. We can say, well, let's order an injection very specific to that nerve root, and then we can see them back and see how they're doing. And that's fine. Sometimes it's really hard to define what's causing their pain, and maybe they're better off seeing a physiatrist or pain management doctor, especially when you get into the realm of things like burning of the nerves, which, you know, you're not really going to find a lot of surgeons who do those sorts of things. Thank you, Mr. Bones. I had images taken of my back and neck, and I was told there are degenerative changes with worn out discs and bone spurs. Does that mean that I need surgery now? No, it really doesn't, Mr. Bones. And the reason why is we all get these over time. You know, and there's a famous study where they took a bunch of 40-year-olds who didn't have any pain at all. They all got MRIs, and guess what? 60% of them showed those kind of findings, okay? And when you get to 60 years old, that's closer to 100%. And so we all have these as time goes on, and it really doesn't affect whether or not you're going to need something or not need something done. It really depends largely on what is going on with you. What are your symptoms? Can you deal with them? What have you tried so far? That does not mean that, you know, MRIs aren't helpful and they aren't important. They really are helpful and they really are important, but when you look at them from my perspective, I got a specific question and I'm looking for a very specific answer. And so while the radiology report, for example, might mention 15 different things, I'm only interested in one of them, and I don't want people to stress out about the other 14.